Hi, I'm Taif, and this is my assessment of the lumbar spine with our fellow student Hannah Wilkinson. Today I'm going to start off with going through the normal procedure of look, feel, move, and any special tests with regards to the lumbar spine. I feel that more so with the lumbar spine than with other joints, it's really important to clear both the joints above and below to see if they have an impact on the lumbar spine. So in this case, I'm going to be, if you turn around for me, Hannah, I'm going to be clearing the thoracic spine, the SIJ, and having a look at the hips as well. So I'm going to start with that. So on that note, now if you turn to face me, please. Okay. What I want you to do here is just come down to a squat with me, and I'm just checking for hip mobility and any asymmetries as she squats. Is she moving, favouring one side versus another? Good. One more. She's able to get good range of movement there. Any pain or discomfort in the lower back when you do that? No? Okay, excellent. Next thing I'll get you to do is just have a sit down onto the bed for me, please. Okay. Looking at the thoracic spine, so you're just going to get to cross her hands, pop her hands onto her shoulder. I want you to turn as far as you can over one side and then over the other. Good. One more time each side. And I don't know if you can see this in the camera, but she seems to be a little bit restricted towards this side. How do you feel there, Hannah? A bit stiffer that way. Okay. Have her lie down for me. Again, back to the hips, just checking hip flexion. Any pain or discomfort here? No. And looking at internal rotation and external rotation. Okay there? Mm-hmm. Next thing I get to do is just looking at the SIJ. I'm going to do the Faber's test. Okay, so from here, just pushing down on the knee. Any pain or discomfort there? And relax. Good. Okay, so hips seem fine, SIJ with the Faber's test seem fine. What I want to do is look at her thoracic extension. So in rotation we found her a little bit limited towards the left side, and for this I'm just going to get you to pop your head off the pillow there. Okay, so I'm going to get her to lift her hands up in the air, just hold there for me, and as she brings them back behind her, I'm checking to see what happens at her spine. Does she excessively arch her lumbar spine as a result of poor thoracic extension? Good, and back. And one more time, but she's able to prevent her ribs flaring and keep a nice neutral posture as she does that. Okay, and relax. Okay, stand up for me please, Hannah. Just one more test for the SIJ joint. I want you to do your stalk test, so stand on one leg and lean back. Good, any pain or discomfort there? No. Good, and swap leg. And again, lean back. Any pain or discomfort? No. Okay, so cleared hips, SIJ, and her thoracic spine. Now we're going to get back onto focusing on the lumbar spine. So from here, just turn side onto the camera, please, Hannah. So I'm going to first of all start with looking. So I'm just scanning up and down her spine, checking for any asymmetries, any erythema, any muscle wasting on one side versus another. Checking for any scoliosis, so is there any curvature in the spine? And it all seems fine there. Okay. Other things to check. I'm just going to look at her iliac crest height. That seems level. And then also checking her PSIS. And again, checking the level of my thumbs on each side to see if there's any asymmetries, and that seems fine. Okay, pop your hands down by your side. Okay, next thing I'm just going to go into feeling up and down her spinous process, checking for any pain or discomfort as I do this, or any abnormalities. Everything feels fine there, Hannah? Yeah. Excellent, just working my way down. Good. Okay, all the way down to her sacrum, and then I'm going to work my way back up, checking her paraspinal muscles. And I'm just checking for tone left versus right, and I feel just slightly on her right side here, there's a bit more tone than her left. Do you feel that as I palpate into this area? First to the other side?
A little bit.
Slightly. Good. Working my way all the way up her spine. Any pain or discomfort as I press in here?
No.
Excellent. Okay, just have a seat on the bed for me. Another test I like to do is to look at breathing. So I want to place one hand onto your chest and one hand onto your tummy. Okay, and the reason I like looking at breathing, just looking to breathe a bit deeper than you would normally. And what I'm looking to see here is she breathing from a diaphragm or is she breathing from her chest? Reason being is if she's a chest breather, they tend to use upper traps and arch the low back. Okay, and this is something then that I can coach her on in subsequent sessions. Okay, and now I want you to exaggerate that and breathe up from the chest. Good, and back down, and again. Excellent. Okay, and then from the diaphragm, so just from the tummy so the camera can see. Good. And one more, and the difference there between arching her back with the chest breathing versus the diaphragm breathing, and relax there. Okay, great. I'm just going to look at some nerve tests. So standing up for me, can you just walk in place on your toes? Excellent. And this is checking her S1 nerve. Okay, and relax there. Can you stand on one leg for me? So this is looking at Trendelenburg sign, and this is checking her L5. Good, and change. Excellent. Okay, can you walk on your heels for me? So this is checking L4, and that seems fine. Have a seat for me onto the bed. Okay, next thing I want you to do is just looking at knee flexion on both sides. So from here, pushing towards my hand. Excellent. Good, that's fine. Checking both sides, pushing towards me. Okay, that's L3. Checking hip flexion, so pushing towards me. And relax. And this side. Very good. And again looking at that L5 nerve root, I want you to extend your big toe in towards my hand. And relax, good, and the other side, and relax, break, good. Have a lie down onto the bed. I'll just put this in. Okay, continuing on looking at the neural test, both legs straight for me. Can you lift your right leg up nice and high, good, and just relax there. Any pain or discomfort in this position? Just a bit tight in hamstrings. Okay, so I'm just checking her straight leg raise test. If she's to feel any pain down the back of the leg, I can check the side of the nerve by bringing the foot down to a position where she's not experiencing any pain, and then just apply some pressure on her foot, pushing it into dorsiflexion. If that recreates the pain, it's a positive straight leg raise test for her sciatic nerve. I'm also checking to see, does she have any pain in her contralateral low back area as I lift up? No issues there? Okay, and that could be indicative of a medial nerve issue on that side. Okay? So, good. Can you turn onto your front for me, please? Okay. I'm just going to pop this underneath your tummy. Okay. So I'm just going to look at the femoral nerve test. So from here, I'm just pulling up through her knee, stabilizing her hips, and if she gets any pain or discomfort of the anterior thigh on the ipsilateral leg, I'm testing. Any pain or discomfort there?
No.
No. And relax. Good. Okay, so clear for that femoral nerve test. Okay, standing up for me, please. Okay, so now I'm going to look at movement of her lumbar spine. And what I want you to do is come down to touch your toes. And for this, I'm just looking to see if there was any scoliosis I found before. Is that further enhanced with her flexion? Good, and stand up again. And come down, looking for the fluid movement of her spine as well. Is there nice segmental movement, or does she just move from the hips and move from the thoracic spine. And I can test that further by placing my fingers on two of her lumbar vertebrae, and as she extends up, my fingers should come together, which is indicative of her using her lumbar spine to move, which is what we want to see. And my fingers are a lot closer there than where they were when she was in flexion. Okay. Next thing, I just want to have a look at your extension. So from here, extend back, just block her knees. Good, and relax. Any pain or discomfort there?
No.
No. So if she has pain or discomfort on that lumbar extension, it could be a sign of some facet joint syndrome or spondylolisthesis, but no issues there. Can you then place your right hand onto your right leg and just slide down on that side? Good. And then the other side. Any pain or discomfort there?
No.
Okay, and just for the camera to see. And again, and what I'm checking for here is her range of movement as well on either side. Does one side feel tighter than the other, or is it pretty similar? Slightly tighter to that side. Okay, excellent. Next test I like doing is using this dowel, which is actually from the functional movement screen which we've been studying. If you turn side onto the camera, please, Hannah. I'm going to place this against your head and your back, okay, and feet shoulder width apart. And what I'm looking to see is the neutral, can she keep that neutral alignment as she performs a squat? So just squat down for me nice and slowly. Does the dowel stay in contact with her head, her thoracic spine and her hips? And you can see that it lifts off from her thoracic spine. Good, and again. And this would be something we'd work on to if we can improve her thoracic extension. Next thing we're going to do, similar concept into her push-up position. Okay, so this is higher level stuff now that she's cleared all her neural tests and there was no issues there. And I'm placing the dowel and she's just going to perform a push-up. Good, and back up. And I hope you can see this on the camera, but the dowel again is raised. It's not in contact with her head. So again, a sign that some areas to work on, perhaps on her head posture and thoracic extension during her exercises, and relax. Really important again on this area, there's a strength conditioning coach called Mike Boyle, and he talks about, if you turn around, Hannah, how some joints need to be really mobile and some joints need to be really stable in the body. So in terms of the spine, you want the thoracic spine to have really good mobility, you want the lumbar spine to be stable, and then if we look at the joint below the hips, you want them to be really mobile. And if you have any issues in the lumbar spine, a lot of the time it can be as a result, as we are well aware, of a lack of mobility in the thoracic spine or the hips. Okay, and that concludes my lumbar spine assessment.